Cognitive impairment is experienced by as many as 50% of MS patients, whether it be related to inflammation in the brain, neuronal damage, or lesions directly in the brain. However, the cognitive impairment can also be experienced as a result of fatigue because, of course, when we're fatigued, our brain doesn't work as efficiently.
It affects anywhere from 25 to even more than 50% of individuals with multiple sclerosis at some point in their course. It can happen at any point during the disease, from being one of the first symptoms that someone experiences to having symptoms later, not until later in their disease. It can affect men and women equally. It can occur at any age.
They might have neuron loss, which is lesions. They might have inflammation of the brain, and all of those things make the brain slow down or have difficulty functioning. So they may experience word retrieval difficulties, which is trying to find the word that they want on the tip of their tongue and they just cannot come up with it. They may experience difficulties recalling information, either information that they knew in the past or difficulty learning information, difficulty processing information. So if somebody tells them information, they might need extra time to kind of process that. It might also lead to being easily distracted. So as a speech pathologist, this could impact meal times. So if they are distracted while chewing, it might go down the wrong way or they might choke.
When changes in cognition occur, it can be scary, and oftentimes we work together as an interdisciplinary team, and we will refer patients to neuropsychologists who also specialize in cognitive function, as well as psychiatrists and psychologists who can help patients navigate the different feelings that they're having as things are changing throughout their life. And occupational therapy in particular can also assist the patients in finding different stress management techniques in order to manage their levels of stress and anxiety.
So it's really the patient coming and telling us that they feel like their thinking is different, and they know themselves better than anyone else, and they can tell a difference. And the things that they commonly tell me are getting distracted easily, like we'll be cooking something on the stove, and if someone interrupts to ask a question, they forget that it's on the stove, or they have trouble finding the right words that they want to say, or remembering where they put their cell phone. Usually it's things that could happen to any of us, but it just seems to happen more frequently to them, and even can start to interfere with their ability to do their job as well as they once did.
Another way to recognize cognitive impairment is if it's taking you longer to respond to questions or to problem solve. We call that a delay in processing speed, and there are things that we can do, both treatment-wise in the clinic as well as activities that we can provide you with to work on at home that can address processing speed and other aspects of cognition. And while we may not be able to improve the cognition, what we want to do is maintain your level of cognitive function. So it's important to continue to exercise your brain, because if you've heard the term use it or lose it, if you don't use it, you're going to lose it and it's going to decline.
So some changes that they can make to their daily routine to help with some of the cognitive changes are setting a schedule. So setting a schedule, they can start to become familiar with it, and that way it doesn't take so much mental effort to always think what's next. You can put up visual reminders, so there's calendars, there's to-do lists, you can do alarms or alerts or timers to let them know when something needs to be done, such as setting a timer on the oven or stove. So if they are forgetful or easily distracted and they're cooking something, they need to have something set so that they don't forget that it's in the oven.
We focus primarily on compensatory strategies. For example, if you're having difficulty remembering items to pick up at the grocery store, we recommend you simply make a list. In terms of medical appointments, using things like a hard calendar or a phone reminder can be very helpful. In addition, if you have trouble remembering things like medication dosages, there are assistive devices such as recurring alarms on your phones or different watches that vibrate that remind you to take your medication. For things such as bill pay, you can use automatic bill pay, and that can help
So to help with their attention or lack thereof, you can help by limiting distractions. So you can make sure that around meal times there's not a lot of distractions, the TV isn't on, there's no iPad next to them, phones aren't ringing, someone's not talking loudly, and that way they can eat safely. And then while they're trying to do their to-do lists or trying to get through a workday if they're still working, having a quiet space for them to work to minimize those distractions, because any distraction is going to pull their attention and make completing tasks that much harder.
So there aren't any medications that have been definitively shown to be helpful for the cognitive changes that happen in multiple sclerosis. There have been a few studies looking at medicines that can enhance the memory circuits in the brain, such as a medicine called donepezil. There was initially one or two small studies that looked like they might be beneficial, but when pooling all the data together from a couple of different studies, unfortunately, it didn't seem to work as well. And so our therapy really has to focus on outside of medications, and that means, one, trying to treat multiple sclerosis itself with the different disease-modifying therapies to help reduce that lesion load, prevent new lesions from happening. And then we have to target those other factors such as depression, sleep problems, and that or other medicines that we're using to treat symptoms that are important, and trying to use as little as possible, but still maintain a good quality of life.
So for patients who are dealing with memory loss or forgetfulness, there's a few things that you can do. You can do memory books, so you can put pictures of family members, you can put pictures of things that they like to do with some written or typed text below it so that they can go through that to help them recall if they can't do it on their own. It's a compensation. Or you could also set up lists of things that they need to get done that day. You can do calendars where they know that they need to go check it. So having it on the fridge and it's always on the fridge, or having that grocery list always on the fridge and they know where to go to get that information.
Some cognitive brain exercises that are good to work on at home include things such as crossword puzzles, word searches, Sudoku puzzles. If you have interest in learning new things, learning new languages can be great. And also trying to learn to do tasks with your non-dominant hand can be good. And all of these activities are great because they force you to form new neural connections. And by repeating those tasks and continuing to learn languages or learn an instrument, you're strengthening those neural connections and creating new neural connections that are only going to help you.